going to be assessing your heart rate. Don't get distracted. Hello there. Welcome. I understand that you have been referred to me via your GP. You're having some concerns about your heart. I'm sorry to hear that, but please be assured that you're in the right place. And more often than not, any issues that are prevalent in the chest area are easily diagnosed, and sometimes they have a very, very simple cause, and it's not the disastrous, scary thing that maybe you have been convincing yourself it is. Dr. Google is not always right. So could you just explain to me in a little bit, what are your symptoms? How long you have been experiencing these symptoms, the frequency, and anything that you take or do to alleviate the symptoms. Okay. Right, I understand. So, before we begin, can I get you to confirm your name and date of birth? That's perfect. And do you consent to me carrying out this cardiologist exam on you today? That's brilliant. So, you don't have to do anything at the moment. I just want to observe you at rest. I'm just going to look at your breathing and anything that might be an indication of any cause for concern. Would you say you're relaxed right now? That's understandable. Your heart can race when you're in a medical environment. There is a specific word for it, but it escapes me right now. But you are rested. Okay. And would you say you are comfortable right now? Any pain or discomfort anywhere in your body? Alright, so I'm going to come a little bit closer to you. I'm going to put my hands on your chest here. Just take a nice deep breath in and out. Okay. Arms out just like this. Okay. Good. I'm just going to have a look at your legs. Have you noticed any swelling or discomfort in your legs? Do you exercise? How often a day? Right. And do you smoke or drink alcohol? And what would you say your diet is like? I see. Alright, well, nothing too concerning there. So if I could bring your hands right out in front of me and just... Yeah, it doesn't matter, palm up, palm down. I'll be asking you to flip them over now and then. So, hands out straight, palm up. Okay. So, I'm just looking for any splinter hemorrhages on your nails. Sometimes you can see little lines in your nails. Okay, and turn your hands over. That's great. Could you just put your fingernails back to back like this? just in front of you, that's fine. Okay. I'm just going to feel the temperature on your hands. Would you say your hands run hot? And they're a bit clammy. No, it's alright to be nervous, that's okay. But would you say your hands are quite clammy all the time? Okay, have you always had this? Okay. So now I'm just going to pinch your tip of your finger. I'm going to assess the capillary refill time. It's going to tell us how quickly the blood flows back into your finger. Okay. So that's fairly quick. Do you get any Reynolds, like white tips on your fingers? I see. So would you say it's more of a stress response rather than environmental? Are you on any medication for that? Alright, I see. No, nothing to be concerned about. I'm just asking these questions to determine if this has any direct impact on your heart or vice versa. Alright, so now I'm going to be listening and feeling your pulse and your heartbeat. So for that, I'm just going to put my 2 fingers on your jugular here and just relax. Okay. Good. And now if you can just give me your wrists. I'm just going to feel the pulse in one wrist. Okay, and now both wrists at the same time. Now I'm going to feel the pulse in the crook of your arm. Okay. Perfect. If I could just get you to put your head to one side. Let me just have a look at your neck here. Just feel the pulse. Okay, on the other side. Okay, good. Do you have any pain in your stomach right now? Any sort of discomfort? Okay, I'm going to be pressing quite firmly onto your stomach, and you just let me know if this feels uncomfortable in any way. Okay, ready? Good. Okay. Was that okay? Great. It's just feeling for the pulse there in this area. So now I'm going to come a little bit closer and inspect your face. Just look straight at me. Just going to have a look in your eyes here. Do you mind if I just quickly pull down your lower lid here? Okay, good. Brilliant. I'm just going to cover your eyes just briefly here. Okay. Good. Could you open your mouth, please? Good. Stick your tongue out and say ah. Good. And then put your tongue to the roof of your mouth. Alright. That's perfect. Thank you. Right. So I'm going to have a little listen to your chest now. So you don't have to do anything, just breathe normally. Okay. Now I'm going to be instructing you to do some deep breathing. Just breathe in through your nose and out through your mouth in, I guess, short, sharp bursts. So like this. Okay, and then we'll do some slow breathing as well. So short, sharp bursts first, and then slow, but I'll direct you. Alright. Okay. Breathe in and out. Good. A little bit faster. Breathe in, out. Good. Breathe in, out. Good. Breathe in, out. Good. Now when you breathe in, can you hold it? And breathe out. Good. Breathe in and hold it. And breathe out. Good. So I'm going to do that again, but I'm going to be feeling the pulse in your neck at the same time. So short, sharp bursts, and then breath hold. Alright. Breathe in and out. Good. Breathe in, out. Good. Breathe in, out. Good. Breathe in, hold. And out. Good. Breathe in, hold. And breathe out. Breathe in, out, hold, and relax. Good. So now I'm going to ask you to do some nice deep breaths in. I won't ask you to do too many of these because they can make you feel a little bit dizzy. So I'll be doing some movements around your body. So just breathe in and out. So like this. Alright, good. Okay, breathe in and breathe out. Good. Breathe in and breathe out. Good. Breathe in. Breathe out. Breathe in. Breathe out. Good. Perfect. Everything seems to be as it should. I can't hear any causes for concern. So the last test that I'll be doing with this stethoscope is to just do some tapping on your body, just like this. Sometimes this can feel like a little mini massage, so please enjoy. You don't have to breathe in any particular way, just breathe normally as in a relaxed state. Alright, here we go. That's great. Well, in all the years that I've been working as a doctor, I have never heard a patient ask for that before, but I think we can make it the exception. Alright, so these just go into your ears here. They are very tight. They're kind of a little pinching, but you get used to them over time. So I'm going to put them into your ears and you're going to listen to your own heartbeat. Alright, here you go. Let's just put them on your ears there. Are you ready? It'll blow your mind for sure. Ready? Can you hear it okay? Wonderful. Move it a little bit for you. You want to hear my heart? Alright. It's a bit faster than yours, I will say, but of course, here you are. You see, a lot faster. Alright, let's take these out. Well, that concludes your cardiology exam. What I will do is actually refer you for a 24-hour ECG, and this is going to monitor your heart throughout the entire day, and this will give us a good base level of what your heart is doing on a normal average day. You don't have to do anything different. You can go about your day as you normally would. It's very discreet. You hardly know it's there. And what we'll do is we'll collate these findings with today's exam, and then actually we'll also book you in for an echogram as well, which is basically like a ultrasound of your heart. So with that and the 24-hour ECG and the physical exam today, we'll have a very, very clear picture of what your heart's doing. Does that sound okay? Perfect. So you can make that appointment at the reception if you like, or alternatively you can book these treatments online if you have access to our online system. You don't? Okay, no. It's probably better to book them in person. I always like to do that. Alright, so it was very lovely to meet you, and please don't worry, your heart sounds perfectly healthy to me, but we'll get to the bottom of your symptoms and what is causing them, I promise. Alright, well, enjoy the rest of your day, and I'll see you soon.